The first case of the novel coronavirus in Africa has been detected in Egypt. Likewise, the first death of the coronavirus disease in Europe has occurred in France. The deceased, an 80-year-old man, was from China's Hubei province and had arrived in France on the January 16th and was quarantined 9 days later. So experts and African leaders have expressed concern that should the virus spread to the continent, it could wreak havoc among the least developed countries with weaker health systems. So the WHO has rushed to prepare African health systems, many of which are overburdened or just simply lack the diagnostic tests.
Up until Friday, Africa had no confirmed case of the coronavirus disease. The first case of a foreigner in Egypt, whose nationality has not yet been disclosed, signals a warning especially to other African countries with weaker surveillance and health systems. All of Kenya's cases have tested negative. But the country still remains among 13 African countries singled out as high risk owing to the strong ties of trade and travel with China. Speaking today in Munich, WHO Director General Dr. Tedros Ghebreyesus warned that each country should prepare to contain the outbreak, which is proving to be more deadly and damaging than terror.
It's impossible to predict which direction this epidemic will take. We are encouraged that the steps China has taken to contain the outbreak at its source appear to have bought the world time, even though those steps have come at greater cost to China itself, but it's slowing the spread to the rest of the world.
France has recorded the first related death of the COVID-19 of an 80-year-old man who had traveled from China's Hubei province and had been quarantined in Paris since January 25th. Only 3 deaths had previously been reported outside mainland China, 1 in Hong Kong, 1 in the Philippines and 1 in Japan. This brings the global death toll to 1,524 in China, including 1 in Hong Kong and 4 globally. According to the China Health Commission, Saturday, February 15th, there are 66,580 confirmed cases in China, 510 confirmed cases abroad. There are 8,413 recovered cases. A 98-year-old novel coronavirus patient from central China's Henan province at Nanyang City Center Hospital has recovered. The patient is now the oldest person in China to have recovered from the virus.
We're concerned about the severe disruption in the market for personal protective equipment, which is putting frontline health workers and carriers at risk. We're concerned about the levels of rumor and misinformation that are hampering the response.
In the latest blow to China's preparations for the upcoming 2020 Tokyo Olympics, the Chinese gymnastics team has been forced to withdraw from next week's World Cup in Melbourne due to the Australian government's travel restrictions after the ongoing COVID-19 outbreak. From observations, the virus is capable of transmission even during the incubation period. Some patients have normal temperatures and there are many milder cases. These are the hidden carriers. This and the large number of travelers who moved from different parts during the Chinese lunar year have accounted for the rapid spread of the virus.
The world spends billions of dollars preparing for a terrorist attack, but relatively little preparing for the attack of a virus, which could be far more deadly and far more damaging economically, politically, and socially.
Previously, Africa has endured 2 Ebola outbreaks in 2014 in West Africa and in 2019 in the DRC. Both were declared public health emergencies of international concern. Can the continent weather this coronavirus disease outbreak? Dorcas Wengera, Citizen TV, Nairobi.